Hi, I'm Dr. Ellen Rainey. I'm a pediatric orthopedist at the Shriners Hospital for Children in Portland. And this is my friend Isabel. And we're here to talk about ways to safely swaddle your babies so you don't damage their hips while you're keeping them secure and comfortable. So swaddling has had a resurgence in popularity due to comfort and keep making babies feel secure and resting more calmly. And we're seeing here demonstrating a way to make their arms and their chest area secure without binding their legs so that they're still able to bend their hips and their hips can still come apart. If you swaddle the hips out straight and in tight, the ball of the ball and socket can actually be forced out of the socket and can cause very severe problems with baby's hips. So you can see that it's real easy for her to bend her hips, and her hips can go out to the side and back in. So there's really, although she's nice and secure up here, she has lots of flexibility and room for motion down here. Swaddling with baby's hips free doesn't in any way change their being on their back, which is the safest way for them to sleep. We mainly worry about babies' hips being swaddled with their legs out straight and tight together over time. If you're carrying a baby from one place to another and you happen to have them in a holder that's going to have their legs together for a couple hours, that's probably not a problem. When swaddling, the baby's legs should always be free to move so that the hips have plenty of freedom to stay in the best position. You want to avoid the hips being out straight, and you want to avoid the legs being tucked real close together. So out straight and close together. So her legs can move up and out, and they're not bound up in any way. Your pediatrician will examine the baby's hips at every well baby check. It's part of the routine examination, and there's some subtleties that can be picked up in examination, but it's usually not a painful problem, and it's not a problem that you would know about when babies are very young. It's a problem that develops a limp when children are old enough to walk, and then when they get to be adults or even older adults, they have a lot more hip problems. If your primary care provider does have a concern, it's important to remember that ultrasound is the best way to evaluate young babies' hips because they're too young for regular radiographs. So ultrasound is the best way, and we have a brand new ultrasound machine here at Shriners that makes it quick and efficient to look at the baby's hips while we're seeing them in clinic. We hope you found this video helpful in finding safe ways to keep your baby comfortable and secure. And if your primary care provider finds any problems with the hips, we're certainly available to help. And we have a team of experts here at the Shriners Hospital for Children, and we are in Portland. Thank you.